Party, they're attacking the Uttar Pradesh government after the killing of a UP journalist Vikram Joshi there. Let's move on now and talk about the COVID figures in the country. India reported close to 37,724 fresh COVID cases and more than 648 deaths in the last 24 hours. With this, the total coronavirus cases in the country is above 11.82 lakhs, while the death toll stands at nearly 28,800. Maharashtra and Tamil Nadu remain the worst affected states. Maharashtra's COVID-19 tally is close to 3.27 lakhs with the addition of 8,369 new cases, while 246 more patients succumbed, including 62 in Mumbai alone. The recovery rate is 63.12% and the positivity rate is 10.99%. Now, according to the tally released by the ICMR, India has conducted nearly 15 million tests so far. Now, even as the daily infections in the national capital have dropped below 1,000, the Sero survey results have revealed that 1 in every 5 individuals in Delhi has been exposed to the virus. These people have shown the presence of antibodies that indicate exposure to coronavirus. Here's a big concern. Over 77% of Delhi population is vulnerable to coronavirus, and most of the infected patients in Delhi have been asymptomatic. The tracks In fact, this is what tracking the Sero survey has revealed. Sneha Mordani is now joining us with more details on this. Sneha, put it into perspective. If a large chunk is still vulnerable to coronavirus, then what does it indicate as far as Delhi is concerned? Even though we are seeing the numbers come down, certainly we can't heave a sigh of relief just yet, correct?
Yes, absolutely. We can't. You know why? Because many are of the opinion that Delhi is far away from herd immunity, and there could be a second peak or slowing of the decline. I don't want to jump into conclusions, but just look at today's numbers. It's more than yesterday. Yesterday, Delhi reported less than 1,000 cases. Now, today it's reported more than 1,000 cases. What does this indicate? That things could change. However, simply talking about the Sero survey, yes, 77% of this population in Delhi is vulnerable. 23% is what is showing Sero prevalence. In some districts, it's as high as 27%, like Northeast Delhi, for example. In North Delhi, it's 27%. In Central, again, it's 27%. Nadra, it's 27%.
Okay.
What this shows is that a larger section of the population over a period of time has got this infection and has developed immunity in the sense from what it appears, maybe for a couple of weeks, maybe for a couple of months. The government also says we don't know just yet, but there has been some amount of exposure. I think that is conclusively established.
Yes, absolutely, because there is no clarity even as of now globally as well as from the WHO as to how long this immunity, if people have antibodies to coronavirus, actually keeps them safe. Sneha Mordani putting that into perspective. Many thanks, Sneha. Now let's listen into Serum Institute CEO Adar Poonawalla, the man who could be India's gateway to a potential COVID-19 vaccine. He says if stage 3 of the trials go according to plan, then we should have a vaccine as early as December.
Let's say by November, your trials are complete. Between that and your drug or your vaccine hitting the market, how much time would you require?
So again, to roll it out so that your viewers understand that how long will finally we get the vaccine as citizens of India, it's probably going to be December and first quarter of 2021. Realistically, large volumes for India would be Q1 of 2021. But a few million doses certainly will be available to the more immunocompromised, the elderly, the healthcare workers. You know, we're planning to have that by November, December. So at least the vulnerable pockets in the main cities where the disease is, we're hoping to protect those people by November, December, and then general public, healthy adults like you and me can get it, you know, a bit later on.
We're taking a very quick break now. News and updates will continue. Stay with us.